So here we are again, removing another very thick ingrown toenail. We are doing this on bilateral toes. These nails are very thick and causing the patient quite a bit of pain. So these are simply just some tourniquets that we are placing around the toes. This is to control bleeding. The nail beds are quite vascular and they bleed quite a bit. And so you want to make sure you control that bleeding, because if you're doing a permanent procedure, especially with phenol, which is an acid, if there's too much bleeding, it will dilute the acid and the acid will not work any longer. So here you can see I'm simply using a tool. It's called a curette to get underneath the nail, loosen the nail off the nail bed so that we can get a removal of the toenail. And now we're simply using a hemostat to continue to separate the nail off the nail bed. And we will remove the toenail in a permanent fashion here. And sometimes these nails are quite persnickety and they take a bit of muscle to get them off the nail bed. And there we go. So the patient was still having a little bit of pain, so I injected a little more local anesthetic around the toe. One of my favorite ways to inject local is with the tourniquet in place. This keeps the local anesthetic directly around the nerves, bathes the nerves, and they tend to work sometimes a little better. So here we are on the right side, simply just doing the same thing. We are using the curette to free the nail from around the nail borders, called the nail eponychium. And this one you can see was able to be removed quite easier. And so now we're using the curette again and running it over the nail matrix. This helps freshen up the cells, and so they'll accept the acid a little better. So the permanent procedure will work and the nail will not grow back. Again, sometimes patients are resistant to the phenol and the phenol won't work and a portion of the nail may grow back. We call this a spicula. So the curette just helps ensure that we do not see a return of the nail. And here we are using the phenol. The Q-tip has been dipped into the acid, and now it's being applied to the cell matrix to kill the cells. The phenol does not work well if there's a lot of bleeding, so you do have to make sure that the bleeding is well controlled before we use the phenol. The phenol is used 3 separate times for 30 seconds. So here we are continuing with the phenol.
I had lunch with Sheila today. I had lunch with Sheila today.
Oh, you did?
Yeah, she was doing okay.
And here's the second round for
You know, Sheila.
This
she
toe?
was busy a little bit and we went out. She's gonna go to Fredericksburg this weekend with John Kelly and her sister-in-law Faye.
Once we have done the 3 rounds of the phenol, we will place a large dressing on the toe. This is because the nail beds are quite vascular and will bleed quite a bit. Once the dressing has been applied, the patient will leave the dressing in place for a few hours. They will typically remove the dressing after a few hours when the bleeding has stopped. They will apply some wound gel that we will dispense to them the day of their appointment to the nail bed with a Band-Aid. They will do that for the next 7 to 10 days, and then they will start to just leave it open and let the nail bed start to dry out. If there is an excessive amount of drainage, which can happen with a phenol procedure, the patient can soak the toe in Epsom salts if necessary. It is normal for there to be drainage. It should be a clear yellow to a brown drainage. Should not be a creamy white drainage. Redness is normal. Should be isolated to just around the toe and will probably be a deep purple to a deep red in color. Should not be a bright red, angry color. Pain is normal. However, pain should quickly dissipate. If the pain starts increasing, that's an early sign of infection and you need to let your provider know. Here we are just applying some ointment.
Is that stuff you put on there? Is that what
And we're going to put the dressing in place.
Yeah.
And we will remove the tourniquet.
Okay, so there's gonna be a big dressing.
Again,
on
this dressing
side
will
today.
stay on for just a few short hours, and then once the patient's home, they will remove the dressing. Thanks for watching.